How's it going, everybody? Nathan Mummer with Healthy Legs. Today I have Dr. Andrew Jones on the line. How's it going, doctor?
I'm doing well, thank you. Thanks for having me.
Definitely, yeah. Appreciate you coming on board today. And Dr. Jones is with Inovia Vein, and they have 4 locations in Oregon, 3 in Portland. So very excited to hear about your experience today with vein restoration. So how did you get started with veins?
Yeah, so I'm a general surgeon by training. When I came into my general surgery practice, I was doing trauma stuff and abdominal stuff, cancers, colon cancer, and breast cancer, and all those sorts of things. And what we found is that there was a real unmet clinical need in our community for people with varicose vein problems and other venous disease, deep vein thrombosis, superficial vein clots. And so we saw an opportunity to really help our community by becoming the experts in this field.
Yeah, very cool. So you guys have come specialized specifically in veins. Is that primarily in the legs?
Yeah, so we do see some veins in other locations. We see people with blood clots in their arms after IVs and things like that. But I would say, 98% of our practice is based on venous disease in the legs.
Okay. And then what do you think you enjoy most about what you do on a daily basis?
Well, I love the patient interaction. That's always been my favorite part of medicine. But for veins in particular, I feel like we can do these minor procedures that are all done in the office under local anesthesia, minimally invasive, and people have wonderful results with very few complications. So you see people that are generally fairly healthy, and we do minor procedures, and it really has a significant impact on their life. And it's wonderful to be able to help people in that setting.
Yeah, that's really cool. And I know it's quite a bit different than it was 15 or 20 years ago, with the procedures that we have now and, minimally invasive, like you said, and then they're pretty much back on their feet same day or next day. Does that sound right?
Yeah. So when I was first trained in general surgery, we used to do vein stripping, which was a procedure done in the operating room under general anesthetic. We would pull the vein out, which caused a lot of kind of collateral damage to the nerves and subcutaneous fat. And it's really uncomfortable for the patient. Recovery was quite a bit longer and the complications were quite high. And with these endovenous procedures, we now do them all in the office. We just mostly do them with ultrasound guidance and through needles, and we can seal off the veins through a variety of techniques. Procedures take 10, 15 minutes. Patients are in the office for maybe an hour. Walk in, walk out. They're back to regular activity the day after the procedure, and they're exercising a couple days later. And most importantly, they have really great results. Their legs feel a ton better, and one of the nice side effects is that the big bulgy veins are gone, so there's a nice cosmetic outcome as well.
Yeah, definitely. I mean, it's huge, just to be able to provide that kind of a solution, and so quickly for them. And what are the most common symptoms that people are coming in for?
So there's a variety of diseases. People come in for spider veins, which are just the small little telangiectasias, the fine veins on the legs, all the way up to open holes in the skin, which is called venous stasis ulcers. Most patients come in with kind of the classic big bulgy veins, maybe with some swelling. With time, they can develop progressive skin changes, but the most of our patients are kind of the classic person with big bulging varicose veins on the legs.
Okay, definitely. Do they, did you mention they're dealing with restless legs and swelling and stuff like that?
Restless legs, aching, throbbiness, heaviness, itching, burning. As the disease progresses, you get more of a reddish discoloration or a brownish discoloration just above the ankle bone. And then the end stage of the disease is where the skin breaks down into an open sore called a venous stasis ulcer.
Sure. Is that common for you guys to see those types of patients?
Yeah, that's probably about 10% of our practice. So
Oh,
it tends to be in patients that are a little older. But yes, we see quite a few people with those venous stasis ulcers.
yeah, that's crazy. That's crazy, especially since a lot of people still think that this is a cosmetic issue.
Yeah, it's our practice. As you said, we have 4 locations. Um, so we're treating many hundreds of patients a month, and I would say maybe less than 5% of our practice is cosmetics. So the vast majority of it is people with big bulgy veins that are symptomatic all the way up to where the skin breaks down into open sores. So there's all sorts of medical problems associated with varicose veins. it's a common misconception that's just a cosmetic problem. And the reality is the vast majority of what we do daily is helping people with medical problems.
Sure. And what kind of specific medical problems do you guys, or do you really define that by, or is that pretty much what you already went over with ulcers and long
Yeah.
term
So what we
things
do
like
with
that?
our patients, we break it down to if they come in with a vein problem, is it a blood clot problem or is it a like a superficial vein problem? For problems with blood clots, superficial blood clots or deep vein blood clots, those are managed a certain way. And then people that have varicose veins, we ask them if it's cosmetic, meaning there's no symptoms associated with it, or medical, where they have aching, throbbing, heaviness, itching, burning, all those kind of symptoms. So generally, insurance companies don't cover cosmetic problems. If someone comes in with spider veins, they just don't like the way they look. That's not covered by insurance. But once they have symptoms associated with their veins, of the ones we described, aching, itching, burning, swelling, or the complications related to venous disease, which are blood clots in the superficial veins, bleeding, skin changes, and skin breakdown, venous stasis ulcers, those are considered medical problems and generally covered by people's insurance programs.
Okay, great. Is that primarily what you are the patients that you work with? Is it primarily covered by insurance? Most of the things that you're working with.
Yeah, most of the patients we take care of, it's covered by their insurance. It's exclusive to each policy, but most of the insurance providers cover the Medicare guidelines, which means that if patients have symptomatic veins and they've tried the medical management, which is compression stockings for a period of time, then it'll be covered by the insurance programs.
Sure. Okay. And you want to talk a little bit about the actual procedures that you offer
Yeah.
and just a couple different options there?
Right. So generally, when people have varicose veins, there's a straight vein under the skin that you can't see called the saphenous vein. That's the kind of the trunk of the tree. And for that vein, we use either heat, which is called thermal ablation, endovenous thermal ablation, or there's new sets of procedures where we don't. With the heat-based procedures, we have to surround the vein with local numbing medication before we can seal the vein shut. There's a new set of procedures where we don't use heat applications. There's adhesives and so forth where we can close off the veins. So that's how we treat the straight veins, the trunk of the tree. And then the branches that come off of that, we either inject with a solution called sclerotherapy, or we make a little nick in the skin and disrupt the vein, which is called phlebectomy. All these procedures are done in the office, local anesthesia. Once again, walk in, walk out. And most of the time they're covered by insurance.
And then, do most patients end up needing, several different procedures, possibly, a couple legs?
Yeah, so it's more common in the left leg than the right. The other thing about venous disease is that it's a chronic recurrent disease process. So when you have your appendix taken out, it's gone, you never think about it again. This is more like having your teeth cleaned. Venous disease is a chronic recurrent disease process. So it's not like you have your teeth cleaned once and you never have to go back to the dentist. About 50% of people will get recurrent veins at 5 years. So generally what happens is someone comes in with problems with their veins. We do a procedure per leg, clean up the veins, and then over the course of 5 to 10 years, they'll get some more veins back. We figure out what's the problem and we clean it up again. So we see people back, on intervals when they have recurrence of their veins and then get them treated.
That's interesting. That's something that I don't think I've really touched on with many other surgeons or clinics that, really, end up kind of not always fixing the exact same veins, but having, additional veins or additional issues to work through.
That's right. So the vein is a tube that has a collagen and elastin matrix. If you have a genetic mismatch, those connective tissue fibers, your veins have a predisposition to stretch out. So we treat one set of veins, and then it's not that the veins we treat come back, but their friends come back. And once again, this is the disease of genetics, time, and gravity. We don't change your parents. We don't stop time. We don't reverse gravity. We clean up the stuff that's a problem now. And when other veins get stretched out and leaky in the future, we do the same to those.
Awesome. Very cool. So what's the aftercare like for the patient? I know we talked about it a little bit, like usually their recovery time is pretty quick. Is there typically any bruising or anything like that?
It really depends on the procedure we do, but for most people, when we use the heat-based technology, which is called radiofrequency ablation or thermal ablation, and then we inject the branch varicosities, they'll have a little bit of bruising on the inside part of the thigh after the procedure, which lasts maybe a week or so. They might have some achiness on the veins we treat, but once again, that's kind of short-lived. I tell people on a scale of 1 to 10, with 1 being minimal pain and 10 being the worst pain you can imagine, the procedure is a 2 or a 3, and the recovery is a 2 or a 3. So our patients are typically wearing compression stockings for about a week after the procedure. We want them up walking around immediately after the procedure. They're returning to regular activity a day after the procedure, and then back to tapering back into exercise 2 to 3 days after the procedure. So the procedure is pretty short, recovery is minimal, and there's not a ton of side effects associated with the aftercare.
Yeah, very cool. And what do you think is one of the biggest pitfalls or biggest challenges that people face when, they're trying to find a good surgeon or clinic these days?
Yeah, there's a big knowledge gap, not only in the general population, but also among physicians about the ways we manage venous disease, varicose veins. So a lot of providers just don't know about these new technologies. The old way we used to do it wasn't very good. And so they would tell their patients, there's not really any good choices, which was true 20 years ago. Now we have all these minimally invasive techniques that have really great success rates with minimal downtime, minimal side effects and complications. And I think it's the biggest issue we have is there's just a kind of a knowledge gap, not only among the patients, but among the providers, that there's something that can be done. And so what we really try to do is educate the patients where we live about what the options are, and also same with the providers. Get out there and meet the referring providers, let them know that there's these options out there for their patients that work really well.
Yeah, very cool. Very helpful. Anything else that you want to touch on that you think we missed? Or
No, I think we covered most of it. I think the take home is that these procedures work really well. They don't take very long. Veins can come back with time, but if they do come back, it's easy to figure out what's the problem and clean them up again. And generally, our patients are really happy with the results, and that's why we keep opening more clinics, because we need specialists doing this that know what they're doing and do kind of take care of this problem. And we have to be able to offer that to our communities.
Yeah, definitely. And you guys obviously must be doing something right. So yeah, very, very good work, and congratulations on all the success. And once again, Dr. Andrew Jones with Inovia Vein. We'll put the link in the post. If you want to come in and see him for a vein screening, or any of their clinics, inoviavein.com. You click the link in the post. And thanks so much for taking the time with me today, sir.
Thanks for your time. Appreciate it.
For sure. Talk to you soon.